Hey, we're on your side with some health news today. In this week's Ask the Doctor, sponsored by National University, some tips for parents to prevent child lead poisoning. Now, last week, a lower cutoff for child lead poisoning was recommended. If this cutoff is adopted, the number of children with lead poisoning can reach 450,000. Dr. Dave joins us now. So basically, they measure how much is in a child's blood. And now the government is saying, we're lowering that number where it's a problem.
That's right, Mike. Originally, the definition for lead poisoning was 10 micrograms of lead per deciliter of blood, and now it's being recommended that it be reduced to 5 micrograms of lead per deciliter of blood because it's thought that the lower levels are enough to give children symptoms of lead poisoning.
So with that lower number, nearly 500,000 children may now fall into that category.
Correct,
okay.
correct.
Okay.
And most folks may not know that lead is a metal that can harm children's brains. At lower levels, it can cause behavioral problems, and at higher levels, it can cause death. And it's lead-based paint and contaminated dust that are the main sources of exposure, and these are seen in homes built before 1978. And this can happen, exposure can happen by children touching and eating paint chips, and it's children under age 6 that are most at risk.
Okay.
Wash your hands, always a good recommendation.
Right. So you want to know the age of your home, when it was built, or any other buildings that your children spend time in, churches, daycares. If it's built before 1978, pay attention. Second, washing their hands before eating the meal, regardless of the age of the building. The third is to clean up any paint chips or any dust that you notice immediately around the windowsill or floors of older homes especially. And the fourth is to use a lead certified contractor for renovations in older homes, including if you're doing any repainting. And the fifth is notify your landlord if you're a renter and you notice any paint peeling inside or outside of the building that you're renting.
Okay, so if parents are worried that maybe their child's around lead, are there symptoms to watch out for, or should they get tested? What should they do?
The symptoms can be very subtle. They can be irritability, nausea, vomiting. So if you are concerned, you do want to bring it up to your child's pediatrician, and it's a simple blood test that can be done.
Okay.
But those symptoms could be mistaken for a lot of things.
Right, which is why prevention is where we really want to focus our efforts.
All right, Dr. Dave, thank you. All right, the doctor joins us every Tuesday on our noon show, part of our Ask the Doctor segment, sponsored by National University. If you have a question for Dr. Dave, you can email it to us at newsdesk@cbs47.tv.